this drawing, this was an example of the thyroid hormone axis. And there was something really important that I forgot to include here. So basically we spoke about the feedback loop. So the long feedback loop from the gland itself. So the hormone T3, T4, more T4, having a negative feedback on the hypothalamus. But there's another negative short loop feedback onto the hypothalamus as well. And that's going to be from the anterior pituitary up to the hypothalamus, okay? And this is also going to be a negative feedback loop here as well. Okay, really important. So make sure you put this in your notes. Okay, so there are really two feedbacks onto the hypothalamus itself. One's coming from the endocrine gland, that's a long loop. One is also coming from the anterior pituitary. So in this example, the increasing levels of TSH will actually have a negative or inhibitory effect on the release of TRH. Okay, and the same would be for ACTH and CRH, etc. Okay. So just a quick addition here. Now I've got some practice questions. Let me get this cleared. I've also got some practice questions from the endocrine system, and then we'll go right away into muscle. Okay, so I'm going to launch a poll here. Okay. Okay, last couple seconds. Alrighty. So which gland releases glucocorticoids such as cortisol in response to increased adrenocorticotropic hormone from the anterior pituitary? So many of you selected A and B, which is thyroid gland and adrenal medulla. Share this. So neither A or B are correct, right? We're talking about glucocorticoids, we're talking about ACTH, we're talking about cortisol release, right? Cortisol is a glucocorticoid. And so this is going to be the adrenal, specifically the adrenal cortex, okay? So the outer part of the adrenal gland, not the adrenal medulla, and definitely not the thyroid or the pituitary. Okay, so the answer here would have been D. Okay, let's look at a few others. All right, so let's see here. Okay, so a lot of response for B, which is correct. The primary function of thyroid hormone is regulating the body's metabolic rate. Okay, we talked about all the examples that thyroid hormone, all the examples of structures thyroid hormone has an influence on. So the weight of the sodium potassium pump, the number of mitochondria, the size of mitochondria, et cetera. And so that's going to be the body's metabolic rate. If we look at some of the other options, decreasing blood calcium level, that would have been calcitonin, secreted from the parathyroid gland. So I could have swapped out the stem of this question and the answer would have been A. I could have also asked about the function of ghrelin. We didn't speak about ghrelin, but that would have been the answer for C. And then we did speak about regulating sodium reabsorption in the kidneys. That would have been aldosterone, okay, which is another adrenal cortex hormone. Okay. So the answer here would have been B. Okay, let's look at, I believe, 2 more. So I'm going to launch a poll here again. All right. Okay, so a majority selected C. Name the hormone secreted by the beta cells of the islets of Langerhans of the pancreas and give its function. So C is correct. Islets of Langerhans, specifically beta cells, secrete insulin. Alpha cells secrete glucagon. And we know that insulin is going to be the absorptive hormone. Glucagon is going to be the post-absorptive hormone, okay? And so those two functions make sense. Okay, so C. And then one final question here. All right, last, okay. All right, so which of the following statements about the post-absorptive state is not correct? Remember, the post-absorptive is synonymous with the fasted state. And so the majority of you selected D, which is insulin is actively secreted. So that's true, that's not a true statement. During the post-absorptive state, glucagon is actively secreted. And if we look at the other options, they're all correct statements, right? That it's primary catabolic, which is true. We're breaking things down as opposed to the anabolic state of the absorptive state where insulin is secreted. Its primary function is to maintain plasma glucose levels. That's also true, right? During the fasted state, we're trying to sequester glucose from our reserve sources. And so we're trying to keep the blood glucose level up to where we can function, especially for the brain. We talked about how important glucose is for the brain. And then C, there's a cessation of nutrient absorption. That is true, right? We're not building things up. It's not anabolic. We're not putting nutrients away for later. We're really trying to use what we have and try to sequester those sources to keep us or to sustain us during this fasted state, okay? So D would have been the incorrect statement here. And remember, when you think about the post-absorptive and absorptive states, think about the big picture of what's happening. Don't get so zoned in onto the fine details. Actually think about what the body would need in a fasted state. We're going to stop lipolysis. We're going to stop proteolysis. We're going to stop storage of glucose into muscle and liver tissues as glycogen. So we're going to decrease all of that, and the opposite is going to happen. We're going to be liberating glucose from wherever we can. So that's gluconeogenesis, making glucose from other sources. We're going to be liberating fatty acids wherever we can. So breaking down those triglycerides and just liberating energy during the fasted state. So just kind of zone out and think about, what would my body, my cells be needing during the fed state? What would they be doing? They'd be storing things away. During the fasted state, they'd be trying to liberate those sources, especially for the brain, okay? And I'm sure if any